If you are struggling with sciatica and you've got symptoms going down the back of your leg, shooting pain, pins and needles, or even numbness, then you definitely need to watch this video. I'm going to be teaching you one simple technique that you can use in 3 different ways, and I will show you all 3 different variations that will benefit you at different stages of your sciatica in order to help you get rid of the pain for good. Hey everyone, my name is Joy Agude. I'm a chartered physiotherapist and the proud founder of The London Physio. We are a virtual physiotherapy service that you can tap into from anywhere in the country. And we can bring physio to you as well, whether you're at work, at home, at your residential home, if you're an elderly patient, or perhaps on a TV set because you're a film star. So if you need help with your sciatica or you need a second opinion on anything else, then please reach out. It's all the w's.thelondonphysio.co.uk, and we would be more than happy to help you. It takes just 2 minutes to book an appointment. In today's video, I'm going to be teaching you that single technique that you are going to use to help relieve your sciatica pain. So before we go into that, let's talk a little bit about sciatica. I've seen a lot of sciatica issues. Sciatica, by the way, is no laughing matter. I've had sciatica myself, and I'm telling you now, it's not pretty. It's one of the most painful, most frustrating things that you could ever have. Now, the term sciatica comes from the sciatic nerve. And the sciatic nerve is the longest nerve in the body. It comes from your lower back and runs all the way down to the tips of your toes. So real sciatica in the sense follows that entire pattern where you're getting the shooting pain, the pins and needles, or the numbness, or whatever you're getting all the way down. Sometimes people might only have these symptoms in their foot, or sometimes they might only have it from the knee downwards. Sometimes they might have it from the back down to the knee. But real sciatica would mean that you have the symptom all the way down, running along. Now, the first thing I need you to know is that sciatica can happen as a result of different things. What's causing the symptom, whether it's pain or pins and needles or numbness, is the fact that something is pushing on the sciatic nerve somewhere along the root. And when I say the root, I mean from the back, from the lower back, your lumbar spine, all the way down, because as the nerve runs downwards, it also runs through certain things, like it runs through muscles, like your glutes muscles, your piriformis, for example. It runs through your hamstrings. You've also got the calf muscles, and nerves really hate being pressed on. They don't like anything pressing on them or pushing on them or squeezing them in any way. So that could be happening in your spine as a result of different things. For example, it could be happening in your lower spine as a result of a bulging disc, a disc that bulges out and now starts to push on the nerve itself. It could also be happening because you've got spinal stenosis. I've made a video on spinal stenosis. I've talked about the exercises that would be really good for you to do. So go and check out that video. And then you could also have things like muscles, for example, squeezing the nerve. So as the nerve runs out of the lower back and runs through your glutes, through the piriformis muscle, you can have tightness there. Sometimes the piriformis muscle even gets tight because the nerve itself is sensitive and it's trying to protect it. And other times it's the other way around. Either way, the end result is that the nerve gets even more sensitive because the muscle is squeezing it even more. As it goes down your hamstrings, same thing. If your hamstrings are tight or squeezing the nerve, then it could be a problem. So anywhere along the root of the nerve, from the spine all the way down to your toes, you could get sciatica. As a physio, our job is to figure out where the nerve is being impinged. Is it being impinged in your lower back, and why? Is it because you've got a bulging disc? Because if you've got a bulging disc, the exercises you do for that will be different to if you have sciatica as a result of spinal stenosis. Spinal stenosis likes flexion, bulging discs like extension. Likewise, the exercises you do for piriformis syndrome, that's slightly different. But in all of these, the one thing you must definitely do is that you must mobilize the nerve. Now, we don't treat nerves like we treat joints and muscles. Nerves are very sensitive structures. So what we definitely want to do is we want to give the nerves some space to breathe. Give them some TLC. We want to kind of just release the nerve a little bit. We want to make sure everything around the nerve that's pushing on it is relaxing and just giving the nerve as much space as possible. And on top of that, we want to glide and slide the nerves. So we don't want to stretch them right to the end of their range, but we just want to glide and slide them, like put tension on one end and take tension off the other. So the one technique I'm going to show you today is exactly that, how to mobilize your sciatic nerve properly. So let's get started. So here we are on the floor. Starting position is that you've got a little support behind your neck. Look ahead of you, so you're looking directly above. So the leg that you're not actually working is going to be bent. That leg is going to support your lower back by making sure that the weight of a straight leg is not pulling on your lower back. Engage your core, keep your core nice and tight, almost as if you're pulling your belly button up and in. So you're really getting that core stability support. So the main exercise, and I'm going to teach you 3 variations. Depending on where you are, obviously, if you're very sensitive, you probably want to start with the first one. And then as your sensitivity reduces and the sciatic nerve gets better, then you can progress to the other one. So this exercise generally is what you call a nerve floss, or some people would call it nerve mobility. For context, in this position, in a straight leg raise position, your sciatic nerve is fully stretched. So remember, it runs all the way down from your lower back all the way down to your toes. Now, once I straighten my knee, I'm stretching my sciatic nerve. And then once I bring my toes down towards me, I'm stretching my sciatic nerve even further, like even more. So what we want to do is we want to avoid this position altogether. So the exercise number 1 is that we're going to bend the knee and bend the foot at the same time. And then we're going to straighten the knee and straighten the foot at the same time. Now, what we're doing essentially is we're putting the pressure on one end. Remember, toes facing, coming down, putting the pressure on one end and taking the pressure off the other end. Now that I straighten my knee, I'm going to put the pressure on one end, and then by pointing my foot away, I'm taking the pressure off. So bend and bend, that's all you need to remember, and straighten and straighten. Bend and straighten and straighten. So you're bending the knee, bending the ankle at the same time, straightening the knee, straightening the ankle at the same time. Bending the knee, bending the ankle at the same time, straightening the knee, straightening the ankle at the same time. Well done. So for the second variation, if you're not as sensitive, then we can go into essentially just doing it one way. So you're just going to work on using the knee only. Doesn't matter what's going on with your foot, just relax your foot. We're just essentially going to work on using the knee. Now for this one, because the knee is not moving, we're going to keep the knee directly above the hip. And that's exactly how you're going to support it. So don't bring your leg all the way here. Just keep the knee directly above the hip. And then all we're going to do is very gently go down with the foot and come up with the foot, okay? So essentially you're bending the knee and straightening the knee. Good. Bending the knee and straightening the knee. Fantastic. And just make sure that your core muscles are engaged the whole time and they are fully supporting your spine. Now, with all of these exercises, we also absolutely want to make sure that we feel no pain whatsoever. If at any point you're starting to feel your sciatic nerve pain, pins and needles, numbness, or any sort of shooting sensation that's getting worse, it's a no. We stop right there. Well done. Variation number 3. So all we've got to do for this one is add an extra stretch at the end of the second one. So what we're going to do is come back to that position where your knee's directly above your hip. And then remember, we just went up and down, but instead we're going to go up to the end of range to wherever feels comfortable for you. And then you're going to bring your foot down towards you and then straighten your foot. So by bringing your foot down, you're adding even more of a stretch and then straighten your foot. Good. Bring your foot down and straighten your foot. Bring your foot down, stretching that sciatic nerve at the end, and then straightening. So I definitely wouldn't do this one if you are really sensitive, because this is playing with the nerve at the end of the range. And we definitely don't want to do that if you're really sensitive, okay? Well done. Amazing! Welcome back. I'm hoping that your sciatica is feeling a little bit better now. A few things I'd like to share before we go. So with these exercises, I would recommend just doing them according to your sensitivity. So if you're in the very early stages, you may only want to do 5 reps or maybe 6 reps, 7 reps and stop. And that might be it. But if you're in the latter stages, then you can maybe go up to 15 reps, 10, 15 reps, that's fine. However, I do want to stress that if any of these exercises are making your pain worse, then please stop. The one thing about nerves, like I said at the beginning, is that we don't want to stress them in any way, shape, or form. So please stop. If your exercises are making the pain worse, or your pins and needles worse, or your numbness worse, please absolutely stop. The other thing I must remind you is, like I said at the beginning of the video, there are different reasons why people have sciatica. So this particular technique I've shown you is to help mobilize the nerve. But don't forget that whatever your reason for having sciatica is, you still need to do those exercises as well. So if you have a bulging disc or if you have spinal stenosis, then you need to mobilize the lower back, the lumbar spine. If you have piriformis syndrome or tightness in your piriformis muscles or your hamstrings, you need to stretch those. So this particular technique I've shown you with the 3 different variations will still have to have some exercises alongside them. If you're struggling, then definitely reach out to a physiotherapist near you. We're a virtual physiotherapy service that you can tap into, and we can easily deal with your sciatica virtually. It's all the w's.thelondonphysio.co.uk. We'll be more than happy to help you. It takes just 2 minutes to book an appointment. If you know anyone that would benefit from this video, then please share it with them. And until next time, look after yourselves and each other.